All right, guys, I want to thank y'all for being a part of the team. So basically, we're all in the healthcare field and we know everything about IVs and central lines, ways to give patients medicines, bloods, fluids, all that type of stuff. So a big problem in the medical field is catheter-related bloodstream infections. About 80,000 people a year get a blood infection related to having a catheter placed inside their body. And last year, some 62,000 people died from having that type of blood infection. So the idea for the cap wrap is to have a chlorhexidine or a medically infused device to put on the end of an IV catheter. And just to show y'all what an IV catheter looks like, here's the end. It's attached to an IV that goes into the patient's body, and basically you screw on to be able to give medicines or bloods or fluids or anything. So we want to try to create a better concept, something that's more cost efficient, cost effective, better for the patients, and hopefully try to decrease these infections. So I have Catherine on my team, I have Jade, and I have Meredith. And we're going to kind of go through this brainstorming session and kind of give ideas, and I'm going to write these up on the board as we go, and then we'll kind of go from there. Afterwards, we'll vote on some of these ideas and see what everyone thinks is best. So Catherine, do you want to start us out?
My first idea is to make it a neon color or a colorful color. That way, because everyone knows caps are the easiest things that get dropped in the bed. That way you can find it and hunt it down, so then you don't have the patient laying on it all day long and then get skin breakdown.
Okay, so we're just going to try to keep it short and sweet right now, and then we'll kind of talk a little more about it afterwards. So just kind of give a short, kind of sweet idea, general, and then we'll get more specifics of it afterwards, and then we'll kind of vote on it after that. So, all right, Jade.
Okay, so I had a few different ideas. One was adding grips to the cap, and then having a dual cap where you could do two things with it, and then maybe making it out of a different material so that it's more cost effective, and then also different colors. But just to remind us on what date to change, like we kind of do with the IV tubing.
Okay, and my ideas are that I think that the cap needs to be the full length of the clave or hub, whatever you decide to call it.
Just do one at a time.
That way, the hub is not exposed to any outside bacteria, and then it's completely covered with medicine. And I think we also need to discuss a length of time that the cap will stay on the clave. An appropriate length of time.
So just to let everybody know, the clave is this part, so the end part of the hub, and just talk about, I guess, covering it more so there's less risk of infection. All right, Catherine, what was your next idea? So we'll just kind of go around in circle.
Sorry. Second idea was like getting going off what Meredith said about it covering the whole thing. Is I guess a way that when it comes off, instead of just screwing it off, that maybe it kind of like popped off a little bit, and that way you could put it back on a little bit easier without, if we want it to go back on.
Adding to that, I think that these caps need to be used one time versus taking off and putting back on.
I think that's good.
What was that, Jade?
I think that once the cap comes off the clave, then it needs to be discarded and you get a new one.
Okay.
And then elaborating on grips, I guess we're always like fumbling stuff, or we can't get the cap off. That's a huge problem. I have like a really big problem. So having maybe like not an antibacterial, but maybe like a chlorhexidine grip, something made out of like a bacteria resistant material.
Okay.
Yeah.
So just make it easier to get on and off. Okay. Anyone else want to expound on their ideas this time?
I think that you need to be aware that if you're going to use it, there is a chance that you could touch. The hub could touch the skin or what you're using, so you need to always have a backup option to still be able to clean in between.
Okay. All right, what else we got?
I think that there needs to be a study maybe with having the cap filled with alcohol versus having the cap filled with chlorhexidine to see which one is more effective.
Okay.